St. Martin. I hereby address you as Prime Minister and Chair of the EOC in an update for today, Saturday, April 25th, 2020, as part of the process to keep the community of St. Martin informed about the latest developments and government's COVID-19 containment, mitigation, and response measures. I know you've just enjoyed a very good production that was just held by CPS, and I know you will look forward to hearing from our medical professionals in the future, as this will be a weekly feature, and I will congratulate them at this moment for an exceptional job, so that you know that your local professionals are quite up to the task. To be able to update you on the latest figures for today, the self-quarantine numbers are at 127, 103 persons are still in isolation, and this is as a result of newly diagnosed persons who have become COVID positive. We have tested in total 295 persons, that is 29 up from the last report. The number of positives are 74, that is 25.1% of persons tested, one more than the last time we tested. Of that number, 47 are males, 21 are females, and the number of persons that have tested negative are 211. This amounts to 42 more than before in our last group that we tested. So of the last pending tests, 42 were negative and 1 was positive. And that is 71.5% of our total number of tested persons. The pending number that is still to be received by our labs is 9. That amounts to 3.1% of the persons tested. So, of the total number of persons we've tested, 71.5 are negative and 25.1 are positive. Of our positive numbers, I would like to state that sadly, 13 have deceased. One more person has passed since our last update. This was a gentleman that was in hospital, and that brings our number to 17.6% of the positive cases. We would like to extend our deepest sympathy to the family and friends of the deceased and wish each and every person dealing with a COVID death as well as a regular death much strength during these trying times, as you're not able to comfort each other as is usual. Our number of recovered persons has also risen with 11, and we now have 33 persons as officially recovered from the COVID-19 disease here on St. Martin. That is a 44.6% of our positive cases. Active cases amount to 28 at the moment, and therefore that is 37.8% of the positive cases. Of our confirmed positive cases, 7 are in hospital and under the care of the medical center. I have asked my assistant to publish the graphs that would show that the pie graph showing the number of positive cases, total, how many deceased, how many recovered, how many active, as well as the total amount of tested cases, whereby the great majority of them have been negative. And I think that bodes well that we also pay attention to our positive numbers as the numbers that show that things are, not as bad as we had thought, because in this way, we are seeing that what we are doing now to flatten the curve is actually working. Of the 7 persons currently in the St. Martin Medical Center, 3 are in the center itself, while 3 are in the medium care pavilion, and 1 is in intensive care in the ICU tent. We wish all persons still struggling with this COVID-19 virus much strength, and we continue to work together with our doctors, with CPS, to ensure that the number will flatten and then slowly start to go down. We will be checking how much on an average daily over the length of time. We've been assessing our data, and hopefully by next week we'll be able to give you a better overview of what has been happening as it relates to our COVID-19 patients, those that we have in isolation and quarantine, as well as those who are being monitored very carefully by our medical personnel. We have had several meetings over the past week with ESFs 5, 6, 7, and 9, which is the police department, the health department, ESF 7 being under VSR, community development and social services, as well as general affairs, governmental affairs, and Ministry of TIAT. Together with the ministers and the ESF coordinators, we have been strategically discussing the next steps forward based on our plans, based on how things are actually going on the ground, and we have decided on the following in our EOC meeting of yesterday, April 24, 2020. It was determined that we should make the necessary changes to the state of emergency in order to further relax the safety and security measures currently in place, but still allow for 3 days of shopping, etc., despite it being a holiday week. The relaxed measures will ensure that some activity, economic activity that is, will still take place while maintaining the necessary safety measures to continue to mitigate the spread of the COVID-19 virus as CPS goes about their day-to-day assessment within our community in order to be able to flatten the curve. The main considerations in regard to the relaxing of the measures, which allow for more businesses to be able to offer their services, allow us to take a step closer to our new normal and maintain the necessary safety measures. The first priority being the health perspective and flattening the curve. The second being law enforcement and reducing civil unrest. The third being economic affairs and thereby mitigating further economic decline. Due to the upcoming public holidays, the new essential business list schedule will allow for the general public to shop on Tuesday, Wednesday, and Thursday. Let me reiterate, Monday and Friday are holidays, and as such, the general public will be allowed to make use of their right to do necessary grocery shopping, going to the pharmacies, or visiting other essential businesses as listed in the addendum to the ministerial regulation on these particular days. Deliveries, of course, will be ramped up, and so more businesses are allowed to do deliveries in this coming week and continuing onwards. This 1 week deviation was to be able to ensure that our public still had 3 days to make use of necessities. On the following week, the Monday, Wednesday, Friday will resume. Additionally, the general public will have access to more business services, such as to be able to pay GEBE, TELEM, and UTS. Also, persons who are renters of homes under the care of the St. Martin Housing Development Foundation are able to do what they need to do on the 3 days that persons are allowed to make use of the public roads. So that is this week, Tuesday, Wednesday, Thursday, and thereafter we are back to Monday, Wednesday, Friday until the regulation has been lifted. Another new addition to the ministerial regulation is the option for the general public to make use of optician service as of next week, also on the 3 days. Several persons have mentioned that they need to make use of the optician and get their glasses renewed, and as such, next week, Tuesday, Wednesday, and Thursday, and thereafter, Monday, Wednesday, and Friday, you will be able to leave your homes once you're doing your shopping, etc., to do so. Persons may make arrangements by appointments to have maintenance and repair personnel come to their homes to do the necessary repairs and maintenance on the given days as well. So on Monday, Wednesdays, and Fridays normally, and next week, Tuesday, Wednesday, and Thursday. Persons also may make use of insurance, notarial, and legal services by appointment only on the above mentioned days. Again, only by appointment and only on the days where the public is allowed to make use of the roads. Veterinary services are also going to be available by appointment only, and those requiring persons needing to go out and about, except for, of course, veterinary, etc., are asked to stay within your own district as much as possible and to respect the zones as has been determined by our national decree, namely the east of the Colby Hill and west of the Colby Hill. We have asked all of the banks, especially and GEBE, TELEM, etc., to ensure that both branches on either side of the hill are open to minimize the amount of movement across the sides. As I mentioned before, veterinary services have also been added to the list that you are allowed to visit during the days that the public is allowed to move. Persons will also be finally able to get their online packages, as the couriers will be allowed to deliver in the coming week and weeks. All these businesses may offer their services through delivery and delivery only. You're not allowed to go to your location to pick it up. Last week, we already allowed for home delivery for baby and maternity stores, hardware stores, and electronic stores and IT sales. This arrangement will also be continuing. Medical practitioners and laboratories and dental clinics are open to the public by appointment all days of the week according to their schedules. This was already allowed last week, and so this will also remain in effect. You do not need a personal waiver for these matters, as you just need proof, some form of proof that you have an appointment with your doctor. Once your doctor issues you a letter to go to the lab or to the pharmacy, then that will serve as your proof in case you are stopped on days when there is the curfew in full effect for the 24 hours. Construction projects are still only allowed for the COVID-19 related projects as well as the police station, as these are emergency services in need of dire repair for the proper functioning during this COVID time. The restaurants that have arrangements with essential services can continue to do so. Unfortunately, I am not going to allow other restaurants to open in the meantime until we can ensure that we have actually flattened the curve. All safety measures apply to all businesses. So if you're allowed to be open for the 3 days, you must ensure that your staff is healthy, therefore no flu-like symptoms, good hygiene and sanitation procedures in place and protocols, and if you do not, you will most definitely be shut down. Persons venturing out on the public road during these times are asked to only do so on a need basis and not to be going out there just to be sightseeing. That complaint has also come forward. Please stay at home for your own health. Only one person per family should be allowed to go out, and that is only one person allowed to stand in line to do any type of shopping. We are totally against any groupings of persons standing in line. One person per family and 2 meters distance in all lines. In cars, there should be no more than 2 persons, as had been mentioned before. Wear protective gear. Many are being homemade, and they are using filters to ensure that the cloth masks are effective. Many companies are selling masks out there. Make sure you get yours, and refrain when you're out in public from hugging, kissing, and handshakes. These are strictly forbidden, as they will most definitely cause the spread of the virus. Clearly defined markings outside and inside of all locations, including at cashiers, and 1.5 meters to 2 meters between clients, as well as in the back of the cashiers. Clearly marked arrows in all aisles showing one direction traffic, as well as ensuring proper social distancing by having persons monitoring this inside and outside the stores. All staff, as I mentioned, must be flu-like free, no type of flu-like symptoms, and wear protective gear on the job, and the job has to provide sanitizing spray or hand sanitizers for customers entering the establishment. Proper sanitization of baskets and shopping carts are also a must, and proper crowd control must be in place. So you must have a security guard or a community leader and ensure that no groupings of larger than what your store can hold is allowed inside. All businesses must ensure that they can put out a good and efficient good delivery system in order to keep the population satisfied. So even on days when you're not allowed to visit the stores, they are allowed to make deliveries. Many have been doing that, and I commend you for doing that and keeping our population as safe as possible. I have also taken note that due to the situation in Curacao, where medical personnel brought in to assist were noted to have been COVID positive, I would like to reiterate that when our medical and technical assistants arrived, that we ensured that they had also been tested prior to coming and that they were tested upon arrival. These persons then also still had to maintain a 2-week quarantine here before going into society, and while working, they must wear protective gear at all times in case they do start to show symptoms at a later time. As we know, testing is a momentopname, and so the next day or a week after, persons can still start to show symptoms, and they are continuously monitored. Also, our Marines and police officers that have come in have been tested and will continue to be tested as long as they are going to be active in our society. We will not put our people at risk when we are looking for assistance. And I must say that the Dutch Marines were in quarantine for 2 weeks before getting on the ship, and they have been at sea for about a week, and they will continue to remain on the ship until we can ascertain that they have been tested and are safe to enter into our communities. I'd also like to clarify that the waiver system will continue as before, with persons on the French side requesting waivers from the Chief of Police or myself. That has been going much better, and those who live on the Dutch side will request it of the prefect, and the website and email address is available on our website. As I come to the end of this announcement for today, I would like to tell the people of St. Martin that no, we are not working in an ad hoc manner. We have very strict plans in place, but we continue to assess the delivery of these plans and how it is actually working in the community. And as such, we are adjusting and ensuring that people can receive what we plan for them to get in the time that it is allotted. Of course, every good plan must have a plan B, C, and D, and therefore, as we adjust moving along and we see that the curve is actually flattening, we can then have a release of more and more services so that the persons on St. Martin can feel more that we are in a sense of normalcy. I must say though that many people are using this time safe at home to be able to find new ways to earn funds, find new ways to become productive while they're at home. We are actively looking at ways to ensure that some of the students who have not yet been able to make of the online classes would be able to do so. We're actively seeking funds as well as ensuring that every child will be able to understand, learn even in this COVID-19 reality. E-government and e-education was always on my let's say, vision board. But COVID-19 gives us a unique opportunity to be able to enforce it right away. No longer can we say we don't have enough money for this or we don't have enough money for that. We must find the money. And with COVID-19 money being available out there in the community, out there in the international world, we will use every opportunity afforded to us to be able to ensure that every child gets the necessary education even while they're at home. So we're looking at ways to get devices as well as internet connection to all our students. Yes, there is EU funds available. You must have your project ready to go. They're not going to give the money directly to the governments of St. Martin, so we have to identify organizations that are ready to go to execute hard work to be able to get those funds moving on St. Martin. This is an opportunity, people of St. Martin. Let's make use of it. St. Martin was not up to par as it pertains to being online and as it pertains to paying bills online, as it pertains to ordering food or ordering materials online. Yes, we know how to order from Amazon, etc. But now here's your opportunity to offer the general public of St. Martin made in St. Martin products. Start your own online business. You start realizing your dreams. It is about time that the people of St. Martin realize the strength that lies within them. Realize the strength that lies within you, each and every one of us, to find their dream. Think of a way of making online business work for you. Let's see how inventive you can be. Even our own local university, yes, can do better in offering more online classes. And I'm willing to sit with each and every one who has great ideas about that. I know many great ideas exist within our community, and together we can solve the problems that the world is facing. And as a matter of fact, we will actually be trendsetters by showing how after this COVID-19, we bounce back better. We bounce back smarter, we bounce back more efficient and able to handle our business. So let's put all our hands on deck, improve our own lives, thereby improving St. Martin as a whole. When we are ready to open St. Martin, people will say, wow, St. Martin has worked hard. Despite the difficulties faced, despite having persons showing up at the hospital undocumented and unregistered by CPS, we are still doing our best and making sure that everybody is informed. Information is power. You make sure you're informed, make sure your neighbor's informed, and make sure that we are all executing a high level of social distancing and personal hygiene, as well as when we go out, so that we do not infect others if we may be positive ourselves and not know it. And if you feel any symptom whatsoever, get tested. By getting tested, we can get you healed, we can get you recovered and back in society. And that is what we want. Because around the world, COVID isn't going anywhere. It is going down and going up. But on our tiny island, while we have the opportunity, let's kick it in the butt and send it on its way. We can do this, people. We can do this, each and every one of us. Have a blessed weekend, and remember, stay strong, stay faithful. We are blessed.